Okay, let's unpack this. Welcome to the deep dive.
Glad to be here.
Today, we're tackling a topic that feels incredibly important and, frankly, a little unnerving, especially if you share your life with pets.
hmm
We're doing a deep dive into vitamin D toxicosis in dogs and cats.
Yeah, it's a serious subject and definitely one we need to be more aware of. We've gathered a whole stack of sources, research papers, articles, all focusing on this condition.
Which can be devastating.
Absolutely. And the scary part is, it can often be caused by things commonly found right in our own homes.
Right, so our mission today is to go through these sources together, really pull out the critical information. We want to understand what vitamin D poisoning actually is.
What it does to the body.
Exactly.
Yeah.
And identify where the danger truly lurks, in your environment. Know the signs to watch for, get a handle on how veterinarians actually diagnose and treat it.
And crucially, how you can help keep your furry family members safe. That's the key takeaway we want people to have.
Think of this deep dive as getting the essential intel. It's about turning potentially complex veterinary info into actionable insights, things you can use to protect the pets you care about.
Well put. Let's get into it.
Absolutely. So let's jump right in. Vitamin D, we hear about it all the time.
Yeah.
It's necessary for health, right? Good for us.
And it's essential for pets, too. That's the paradox here. Vitamin D is absolutely indispensable. It's crucial for maintaining that delicate balance of calcium and phosphorus.
Which they need for bones and muscles.
Strong bones, yes. Proper muscle function, nervous system function, even a healthy immune system relies on it.
Okay, so they definitely need it. But unlike us, we can get some from the sun, right? Is that the same for them?
Not really. Dogs and cats primarily get their required vitamin D from their diet. Their skin just doesn't synthesize much of it, unlike ours.
Interesting. So they rely on food.
They do. But here's the flip side, the dangerous part we're focusing on today. In excess, vitamin D is profoundly toxic.
Not just a little bit bad, but really toxic.
Profoundly toxic, potentially fatal. An overdose is a genuine medical emergency.
So there's a really fine line then between helpful and harmful.
A very, very narrow therapeutic window, especially for vitamin D3 cholecalciferol, which is the form we see most often in supplements and, unfortunately, toxins.
Okay.
The core problem, as these sources repeatedly emphasize, is that an overdose leads to a condition called hypercalcemia.
Hypercalcemia, too much calcium.
Exactly. Excessively high calcium levels in the blood and often high phosphorus levels to hyperphosphatemia. This completely throws off their body's ability to regulate these critical minerals. It's a massive disruption.
High calcium, high phosphorus. Okay, that's the result. But how does this essential vitamin actually do that? Like, what happens inside the body to turn it into a poison?
Right. This is where it gets really interesting and maybe a bit counterintuitive based on normal physiology. When a pet ingests vitamin D, particularly D3 cholecalciferol.
Which is the common one.
The common one, yeah. It's first processed, metabolized in the liver. It turns into a compound called 25-hydroxycalciferol, or calcifediol.
Calcifediol. Okay, got it.
Now, normally, the body keeps tight control over the next step. It sends that calcifediol to the kidneys to be converted into calcitriol. That's the really potent active form that precisely manages calcium levels.
The final active form.
Right. But when there's a massive overdose, the whole system just gets overwhelmed. That initial compound from the liver, calcifediol, builds up to incredibly high levels. And here's a key insight from the research. Under toxic conditions, this calcifediol itself becomes the predominant circulating and active toxic form.
Wait, so it's not just the final superactive form that's the problem in an overdose. It's that intermediate step that becomes toxic when there's just too much starting material.
Precisely. It's like the intermediate product bypasses some of the normal checks and balances when the levels are just sky high. And the final active form, calcitriol, its levels also increase significantly. So you have both contributing to the toxicity. The sources also mention a synthetic compound, calcipotriol. It's used in some human psoriasis creams.
Right, you mentioned creams.
Yeah, and this stuff is interesting because it doesn't even need that liver or kidney activation. It's basically already active, so it can start causing problems almost immediately after ingestion or absorption.
Faster acting then.
Faster, but it seems to have a shorter duration in the body compared to cholecalciferol. Still very dangerous, though.
Okay, so whether it's the calcifediol, the calcitriol, or this calcipotriol from a cream,
Yeah.
what are they actually doing to cause those high calcium and phosphorus levels?
They essentially crank up all the body's mechanisms for getting calcium. They tell the body's calcium regulators to just go haywire.
How so?
Well, these toxic forms dramatically increase how much calcium is absorbed from the food in the gut. They also stimulate the bones to release stored calcium into the bloodstream resorption, it's called.
Pulling it out of the bones.
Yes, and they tell the kidneys to hang on to calcium to reabsorb it instead of letting it filter out into the urine.
So the body is just hoarding calcium from everywhere it possibly can. Gut, bones, kidneys.
Exactly. It's driving blood calcium levels way, way up. And phosphorus often follows. And this is a crucial and frankly pretty scary point the sources highlight. Cholecalciferol, the G3, and its toxic metabolites stick around in the body for a long time.
How long are we talking?
Weeks.
Weeks. Wow. So any damage that happens and any treatment, it's not going to be a quick fix, is it?
Absolutely not. Treatment is often prolonged and intensive because the toxin persists for so long it keeps causing problems.
And what's the ultimate consequence? All that extra calcium and phosphorus floating around, where does it go?
That leads to the most devastating outcomes, something called metastatic mineralization or dystrophic mineralization. Basically, calcium starts getting deposited abnormally in the soft tissues of vital organs.
Calcium building up in the organs. That sounds awful.
It is. This isn't just, harmless calcium sitting there. It actively damages the tissues. It causes inflammation and leads to organ dysfunction and ultimately organ failure.
Which organs are most affected?
The kidneys are particularly vulnerable. They seem to be a prime target for this mineralization.
So kidney damage is common.
It leads to calcification within the kidney tissue, damage to the crucial filtering units called tubules, proximal tubular necrosis, and often results in acute kidney injury or even irreversible kidney failure. That's the most common and often the most devastating outcome we see.
Kidney failure. Okay. What else?
Other systems are definitely hit hard too. The cardiovascular system can suffer. You can get mineralization in the heart muscle itself, especially the atria, or in the walls of large blood vessels. This can lead to abnormal heart rhythms, arrhythmias, like slow heart rates or extra beats.
So heart problems too.
Yes. And the gastrointestinal system is frequently affected. You often see anorexia, the pet just doesn't want to eat. Vomiting is common, sometimes with blood, which is called hematemesis. You might see constipation or sometimes diarrhea. The sources mention widespread mineralization in the stomach wall and intestines, which can lead to ulcers and bleeding. That can show up as dark, tar-like stools, melena, from digested blood.
So it's literally damaging organs from the inside out with these calcium deposits. That's intense.
It can be that severe, yes. The respiratory system can also be involved. Mineralization in the lungs can make breathing difficult. That's dyspnea. You might even see pulmonary hemorrhage, bleeding in the lungs.
Breathing problems.
Musculoskeletal signs can include muscle tremors. And the nervous system isn't spared either. You might see depression, confusion, an unsteady walk or gait, which we call ataxia, or even seizures in severe cases.
The seizures too, wow.
They even note mineralization in places like the soft palate or salivary glands. It's really a multisystemic toxin. It can affect almost any soft tissue.
Given how much damage this can cause and how many systems it affects, where are pets typically encountering these dangerous levels? It sounds like it must be from pretty potent sources.
Yeah, accidental exposure is overwhelmingly the main driver here. And unfortunately, some of the most common sources are things many of us might have around the house, maybe without fully realizing the risk. The most frequent cause of vitamin D poisoning in both dogs and cats, according to these sources, is rodenticides. Rat and mouse poisons that specifically contain cholecalciferol, that vitamin D3 we talked about.
Ah, okay. I know some use blood thinners, but others use vitamin D.
Exactly. Brands like Quintox, Rampage, Ortho Rat Be Gone, Mouse Be Gone are examples mentioned in the literature. These are designed to be highly toxic to mammals.
How toxic?
Very. The sources note that in dogs and cats, signs can be seen at doses as low as 0.1 milligrams per kilogram of body weight.
That sounds tiny.
It is. And hypercalcemia, the high calcium, can develop around 0.5 milligram per kilograms. Even a small amount, like licking up a little bit of bait, can potentially be lethal depending on the pet's size and the concentration.
Wow. Okay, so rodenticides are a big one. What about things meant for people?
That's another major and I think often underestimated source, human medications and supplements.
Like vitamin D pills.
Exactly. Oral vitamin D pills, drops, chewables, even multivitamins. They often contain massive concentrations compared to what a pet needs or what's safe for them. Even a single pill or a few drops of a concentrated liquid could easily be toxic, especially for a smaller dog or a cat.
It's just one pill.
Depending on the strength, absolutely. And critically, something maybe less obvious, topical psoriasis creams or ointments.
Psoriasis cream, the stuff people put on their skin.
Yeah.
How would a pet?
They can lick it. They might lick it right off the tube if it's left out, or they might lick it off someone's skin after it's been applied. Brands like Devonex, which contains that synthetic calcipotriol we mentioned.
Ah, the fast-acting one.
Yes, the sources specifically call out Devonex as a leading cause of this type of vitamin D congener toxicity in dogs. It's a real hidden in plain sight kind of danger.
Wow. I mean, I would never have thought a skin cream could be that dangerous if ingested. Yeah.
It's not intuitive at all, which is why this awareness is so important.
Weird.
And finally, dietary issues can sometimes be a source.
Licking their own food.
It's happened. Poorly formulated commercial pet foods have, unfortunately, caused outbreaks and led to recalls because of excessive vitamin D3 added during manufacturing errors. The sources mention specific outbreaks in 2000, 2006, and 2010 linked to dog food.
Manufacturing errors.
Yeah, okay.
And also, homemade diets. If they're not carefully balanced by someone who really knows what they're doing, like a veterinary nutritionist,
You could accidentally add too much.
easily,
Yeah.
especially if you're incorporating ingredients naturally high in vitamin D, like liver or maybe certain fatty fish or eggs, without precisely calculating the total amount. It's easy to overdose if you're not careful with the formulation.
Okay, so the danger isn't just obvious poisons like rodenticides, but everyday things, human vitamins, skin cream, and even potentially their own food if something goes wrong in formulation or manufacturing. That really highlights the need for vigilance.
It really does.
So what signs should someone be watching for? If they suspect their pet might have gotten into something like this, what would they see? This is another really critical piece of information from the sources, and it makes diagnosis tricky. The signs are often delayed.
Delayed, not immediate.
Not usually, no. This is because the ingested vitamin E, especially the cholecalciferol, needs time to be metabolized in the liver and kidneys into those toxic forms we discussed, calcifediol and calcitriol.
Ah, right. The processing takes time.
Exactly. Peak toxic effects, and therefore the most obvious clinical signs, might not even be reached for 48 to 96 hours after they actually eat the stuff, sometimes longer.
2 to 4 days later, that makes it so much harder to connect the dots, right? If you didn't actually see them eat something suspicious a few days ago.
It makes it incredibly difficult. The onset times can vary a bit depending on the compound. That calcipotriol from the cream might cause signs a bit sooner, maybe 6 to 12 hours. But the cholecalciferol from rodenticides or supplements, you're typically looking at 12 to 36 hours before signs start, and severe signs might take several days to really develop.
Okay, so what are those first signs? The early, maybe more subtle ones?
Initially, the signs are often quite vague and nonspecific. Things like just seeming down depression or lethargy, weakness, not wanting to eat, that anorexia again, maybe some vomiting or diarrhea.
Pretty general symptoms.
Very general. A key sign, though, that vets often pick up on is increased thirst polydipsia, and as a result, increased urination polyuria. The body's trying to flush out the excess calcium. You might also notice some abdominal pain if you press on their belly, or maybe muscle tremors.
Increased drinking and peeing, that's a big clue.
It can be, yes. But again, lots of things can cause that, which is why linking even vague signs back to any potential exposure history is so vital.
And what about as things get worse? What are the more severe signs?
As the toxicity progresses and organ damage starts setting in, you'll see more alarming signs. That bloody vomit, hematemesis, or the dark, tarry stools, melena, indicating more significant internal bleeding. Difficulty breathing, dyspnea, or a really rapid breathing rate. Abnormal heart rhythms might become apparent. Neurological signs can worsen, leading to confusion, a very unsteady, wobbly gait ataxia, or even seizures.
Seizures. Okay, that's definitely severe.
And during a vet exam, they might confirm some of these signs, plus possibly find pain when they feel the kidneys or abdomen, maybe notice excessive drooling, or even see lesions or ulcers in the mouth.
So the signs really start subtle and nonspecific and can ramp up to very severe life-threatening problems over a couple of days.
That's the typical progression, yes.
How does a vet actually confirm that this is vitamin D poisoning specifically and not one of the many other things that could cause similar signs?
Well, the absolute most critical starting point, as we've kind of hinted at, is a detailed history from the owner.
Asking questions.
Lots of questions. Did the pet have any possible access to potential sources? Rodenticides in the garage, vitamins spilled on the floor, someone using a psoriasis cream? Knowing about, or even just suspecting, an exposure is the #1 clue.
So being honest with your vet is crucial.
Absolutely. And the sources really stress this. If you ever suspect your pet got into something, bring the packaging with you to the vet if you possibly can. The box, the bottle, the tube.
That makes perfect sense because the packaging tells you the ingredients, the concentration.
Exactly. It gives the vet vital information immediately. So, history first, then a thorough physical examination. And then essential lab tests are the next step, blood work and urine tests.
What are they looking for in the lab work?
The hallmark findings, the things that really point towards vitamin D toxicosis, are those dangerously high calcium levels, hypercalcemia, and often high phosphorus levels, hyperphosphatemia. We're talking total serum calcium often above 12.5 milligdl, ionized calcium above 6.0 milligdl, and phosphorus often over 8 milligdl.
Those high calcium and phosphorus levels again.
They're key. And remember, the timing might differ. Calcipotriol might cause a faster rise that doesn't last as long, while calciferol effects are delayed but persist for weeks. Checking kidney function is also crucial, looking for azotemia that's elevated BUN and creatinine blood levels, indicating the kidneys aren't filtering waste properly.
Because kidney damage is so common.
Right. A urine test, a urinalysis, can also provide clues. It might show the urine is very dilute, meaning the kidneys can't concentrate it properly. That's hyposthenuria. It might show protein leaking into the urine, proteinuria, or even sugar, glucosuria, if the kidney tubules are damaged.
Other things in the blood work.
You might see other abnormalities too, like low potassium levels, hypokalemia, or changes in blood pH, like metabolic acidosis.
Okay, so the standard blood and urine tests are key for seeing the effects on the body, the high calcium, the kidney damage. Are there specific tests for the vitamin D itself to definitively prove it?
Yes, there are specialized blood tests that can measure the actual vitamin D metabolites like calcitriol and that liver product calcifidiol. Measuring those would give a definitive diagnosis. However, and this is a big however.
They're not always available.
Exactly. The sources note these specific metabolite tests are often not readily available in a standard veterinary practice, or they have to be sent out to special labs, which means results can take days. And time is critical here.
So you can't always wait for those specific tests.
Often, no. Vets might measure the serum 25-hydroxy vitamin D level, that calcifidiol. With cholecalciferol toxicity, that level is typically very, very high, especially early on. But with calcipotriol from creams, it might actually be normal, which can be confusing. A really useful test, though, if available, helps differentiate this from other causes of high calcium. It's measuring parathyroid hormone, or IPTH. In vitamin D toxicosis, the body tries to shut down its own calcium production, so IPTH levels are usually suppressed, very low. In many other conditions causing high calcium, IPTH is normal or even high.
Ah, okay, so low IPTH points towards vitamin D toxicity.
It's a strong indicator, yes, but again, availability can be an issue.
So realistically then, a definitive diagnosis using those specific metabolite tests might not be immediately possible in many cases. Vets often have to rely on a presumptive diagnosis.
That's very often the reality. It's based on the combination of a suggestive history, potential exposure, those characteristic clinical signs we talked about, and especially the hallmark lab findings that significant hypercalcemia and hyperphosphatemia, plus evidence of kidney injury.
Putting the pieces together.
Exactly. Sometimes imaging, like an ultrasound or x-rays, might also help by showing evidence of that mineralization, those calcium deposits, in the kidneys or other organs. That adds more weight to the diagnosis. But usually that combination of history, signs, and key lab results is enough to strongly suspect vitamin D toxicosis and, crucially, to initiate treatment immediately.
And speaking of treatment, how do vets fight this? It sounds incredibly complex and really serious.
It is. It requires immediate, really aggressive intervention. And as we've mentioned, often a long period of hospitalization. The treatment approach described in the sources is definitely multimodal, meaning vets use several different strategies all at the same time.
Not just one magic bullet.
No, definitely not. And the absolute most critical thing, if you even suspect your pet might have gotten into something potentially toxic, the number one thing you can do is not wait for signs to appear.
Don't wait.
Do not wait. Contact your veterinarian or a specialized animal poison control center immediately. Time is absolutely of the essence.
That's a huge point. Don't wait for symptoms, because they might be delayed anyway.
Exactly. Waiting could allow irreversible damage to occur. There are excellent resources like the Pet Poison Helpline or the ASPCA Animal Poison Control Center. They're available 200-4/7. Call them or your vet right away. Have the product information handy if you can, what it was, how much they might have eaten, when it happened.
Okay, so immediate call to poison control or the vet. Then what happens when you get to the clinic? What's the first step?
If the ingestion was very recent, like within a few hours, and the pet is stable, not already showing severe signs, then decontamination is a priority, trying to get the toxin out before it's fully absorbed.
How do they do that?
This might involve inducing vomiting. But, and this is vital, this should only ever be done by a veterinarian or under their direct guidance. You should never try to make your pet vomit at home without professional instruction, as it can be dangerous.
Okay, vet-induced vomiting only. What else?
Activated charcoal is usually given. It's a liquid that binds toxins in the stomach and intestines, preventing them from being absorbed into the bloodstream.
Like a sponge for the poison.
Kind of, yeah. And because vitamin D undergoes enterohepatic recirculation, meaning it gets excreted in bile and then reabsorbed from the gut, multiple doses of activated charcoal are usually needed maybe every 6 to 8 hours for a day or two to keep catching it.
Multiple doses. Okay.
The sources also mention a newer recommendation, sometimes used alongside or instead of charcoal, cholestyramine. It's a bile acid sequestrant. It binds up those bile acids that the toxin gets mixed up with in the gut, helping to eliminate it faster. Some studies suggest it might help shorten hospitalization time. Decontamination is especially important for those calcipotriol ingestions from creams because they act so quickly. For cholecalciferol, if clinical signs like high calcium are already present, it usually means a day or more has passed, and decontamination is probably not going to be very helpful at that point. The poison's already absorbed.
So, first step is getting as much of the toxin out as possible, if it's early enough. Then the focus shifts to fighting those dangerous high calcium and phosphorus levels that are already in the system.
Exactly. That becomes the main battle. And the cornerstone, the absolute fundamental treatment, is intravenous fluid therapy, giving fluids directly into the vein.
Why are fluids so important?
Especially using normal saline, 0.9% sodium chloride. It does a couple of things. It helps promote calcium excretion through the kidneys, basically flushing it out. It also maintains hydration, which is critical for supporting kidney function, especially when the kidneys are already under attack from the calcium. This usually requires continuous 5E fluids, often for many days.
Constant fluids. What else?
If the pet is able to eat, feeding a prescription diet that's specifically low in calcium and low in phosphorus is also recommended. And then medications are essential to actively lower the calcium.
Like what kind of meds?
Corticosteroids like prednisone or prednisolone are commonly used. They help in a couple of ways. They decrease how much calcium is absorbed from the gut, and they increase how much calcium is excreted by the kidneys. They're typically given by mouth once the pet isn't vomiting, and the dose is gradually tapered off over time.
Steroids. Okay. Anything else to get the calcium down quickly?
Diuretics, specifically loop diuretics like furosemide, Lasix, can also be used. They directly increase calcium excretion by the kidneys. However, you have to use them cautiously because they can also cause dehydration, which would be bad for the kidneys. So careful monitoring is needed, and often they're stopped if other treatments, like bisphosphonates, are started.
Bisphosphonates. What are those?
Yes. The sources highlight these drugs. Common ones are pamidronate or zoledronate as being considered the most effective treatment for severe, persistent hypercalcemia caused by vitamin D toxicity.
Most effective. How do they work?
They work primarily by inhibiting osteoclasts, the cells that break down bone. So they directly block that release of calcium from the bones into the bloodstream, which is a major driver of the high calcium levels in this poisoning.
Stopping the calcium release from bones.
Exactly. These are given as slow intravenous infusions. Pamidronate, for example, is often given over 2 to 4 hours. And they can significantly lower calcium levels, usually within 24 to 48 hours. But because the underlying toxin, the cholecalciferol, persists for weeks, repeated doses of bisphosphonates are usually necessary, maybe every 3 to 7 days, depending on how the calcium levels respond.
Repeated doses. Are there risks?
There's some caution mentioned about potential kidney toxicity, especially with higher or more frequent doses, so vets have to monitor kidney function closely. It's a bit of a balancing act.
Okay, so fluids, diet, steroids, maybe diuretics, and definitely bisphosphonates for severe cases. Any other treatments mentioned?
There's an older option, salmon calcitonin. It can lower calcium, but the effect is often short-lived. Pets can become resistant to it, and there can be side effects like vomiting or even allergic reactions. It's much less commonly used now that bisphosphonates are available. And importantly, you should not use calcitonin and pamidronate together. Also, if the pet is eating and phosphorus levels are very high, phosphate binders might be mixed with the food to help reduce phosphorus absorption from the gut.
Wow, that's a really complex mix of treatments, a lot to manage. And I imagine there's a lot of just general supportive care needed too, keeping the pet stable through this crisis.
Oh, absolutely. Supportive care is vital. This includes correcting dehydration, managing any electrolyte imbalances that develop, like low potassium, which can happen with fluids and diuretics. In very severe kidney failure cases, more advanced treatments like peritoneal dialysis might even be considered, though that's usually only at specialty centers.
What about bleeding or other complications?
If there's severe anemia from GI bleeding, blood transfusions might be necessary. Because the gut lining can be damaged by mineralization, antibiotics are often used prophylactically to prevent secondary infections. If the pet refuses to eat for a long time, anorexia, nutritional support through feeding tubes might be needed. Pain management is important, controlling seizures if they occur, usually with drugs like diazepam, managing any abnormal heart rhythms, using medications to protect the stomach lining like sucralfate, and drugs to control vomiting like meropitant cerenia. It's really about supporting every affected body system.
It sounds incredibly intensive, all hands on deck. And this all requires them to be in the hospital the whole time.
Yes, prolonged hospitalization is almost always required for treatment to be effective. The sources recommend a minimum of 48 hours just for initial monitoring, even in suspected cases treated early. But for confirmed cholecalciferal cases with high calcium, hospitalization is often much, much longer. We're talking potentially weeks.
Weeks in the hospital.
It can be, yes, because that toxin persists for so long, and calcium levels need continuous management and monitoring. Daily monitoring of blood calcium, phosphorus, and kidney values, BUN creatinine, is essential. After giving a bisphosphonate infusion, they need even more frequent monitoring, like at 24, 48, 72 hours, then maybe every couple of days initially.
Wow. The sheer length and intensity of the treatment really underscores how serious this is. It's not a quick in and out situation.
Definitely not. It's resource intensive, requires intensive nursing care, and can, unfortunately, be quite costly for owners because of the duration and complexity. It's a marathon, not a sprint, for treating these cases.
Right. Now, you mentioned earlier that both dogs and cats are susceptible, but are there any key differences in how vitamin D toxicosis affects them, or how they handle it?
Yes, there are some interesting species differences noted in the sources. While both are definitely susceptible as carnivores, there is some evidence and theory suggesting that cats might have a somewhat higher resistance or tolerance compared to dogs.
Oh, really?
Right.
Cats might handle it better. Why is that?
It seems to come down to a difference in metabolism. Cats possess a specific metabolic pathway involving an enzyme called C3 epimerase, which dogs largely lack. This pathway produces a different form of vitamin D metabolite 3-epi25-OHD3, which might be less toxic or potentially even protective in some way. Dogs rely more heavily on a different enzyme, 24-hydroxylase, to regulate and break down vitamin D, and this pathway might get overwhelmed more easily during an overdose.
Huh. So cats might have a sort of built-in biochemical defense mechanism that dogs don't have as much.
That's the current thinking based on the research described. Some studies mentioned showed cats tolerating surprisingly high doses of vitamin D3 supplementation without showing clinical signs, even though their blood levels of the vitamin metabolites got very high. It suggests they might utilize or process D3 differently or more efficiently, or perhaps are just less sensitive to its toxic effects.
So the toxic dose might be different.
It appears so. Dogs seem more sensitive. Remember those toxic dose numbers we mentioned earlier? Signs in dogs can start around 0.1 milligirokilograms. Significant mineralization and kidney damage occur above 0.5 milligirograms, and the lethal dose can be as low as 2 milligirokilograms in some cases. To put that in perspective, one source calculated that just 1 milligram, that's the 1,000 micrograms, could be toxic for an average 22-pound, 10 kilograms dog.
Wow, 1 milligram for a 22-pound dog. That is a startlingly small amount when you think about how concentrated some human supplements are.
It really highlights their vulnerability. While cats are still at risk, especially from large exposures, they might tolerate relatively more than a dog of the same size. The onset of signs might also differ slightly, on average maybe 1 to 3 days in cats versus 12 to 36 hours in dogs, so there's overlap. So the key point is you can't assume the same dose will affect them identically. They're not just small dogs in this context.
Good point. Okay, given how severe this poisoning is, the intensive treatment, the potential for long hospitalization, what's the prognosis? How likely is a pet to actually recover?
Yeah, that's the crucial question. The prognosis really depends heavily on a few key factors, but the most important one is when treatment is started relative to the exposure and development of signs. And also, of course, how severe the signs and organ damage are when they finally get veterinary care.
So timing is absolutely everything here.
It truly is. It makes the biggest difference. If treatment is started before hypercalcemia develops, for example, if an owner knows their pet ate something, calls immediately, and the vet starts decontamination and preventative measures right away, the prognosis is generally considered good.
Okay, early intervention is key. What if the calcium is already high?
If hypercalcemia is already established, but kidney function is still relatively okay, BUN and creatinine are normal or only mildly elevated, the prognosis shifts to fair to guarded. Recovery is possible, but it will require intensive treatment.
And if the kidneys are already badly damaged?
If treatment is delayed until after significant kidney failure has already occurred, meaning azotemia is moderate to severe, then the prognosis drops significantly. It becomes guarded to poor. At that point, irreversible kidney damage may have already happened.
So the window for a good outcome closes quickly once the kidneys are hit hard.
It seems so. Also, the presence of other severe clinical signs definitely worsens the outlook. Things like uncontrolled seizures, evidence of profound kidney injury on lab work or imaging, significant GI bleeding, hematemesis or melena, serious cardiac arrhythmias, or evidence of mineralization in the lungs. All of those point towards a more guarded or poor prognosis. And generally, the higher the estimated ingested dose, the worse the expected outcome.
Makes sense. Now, you mentioned mineralization, the calcium deposits in organs. Is that damage permanent? Or can the body reverse it if the pet survives?
That's a really important question. The mineralization itself, those calcium deposits, can sometimes lessen or even resolve over time. Once the underlying cause, the high calcium and phosphorus, is controlled and the toxin is finally cleared from the body, it might take weeks or months.
So the deposits can go away? That sounds hopeful.
It is, but, and this is a critical but, permanent functional damage might have already been done to those organs during the period of severe hypercalcemia and mineralization. Even if the calcium deposits eventually regress, the tissue scarring or loss of function might persist.
Especially in the kidneys.
Especially in the kidneys. Chronic kidney disease or failure is a major potential long-term complication, particularly noted in cats that survive the acute toxicity. They might need lifelong medical management, special diets, fluid therapy, etc. for their kidneys. Other potential long-term issues could include ongoing heart problems if the heart muscle was damaged, or chronic digestive issues if there was severe GI ulceration and scarring.
So even if they survive the initial poisoning, recovery doesn't necessarily mean a full return to their previous health. There can be lifelong consequences.
That's a very key point the sources make. Because the toxin persists for so long and the damage can be severe, there can absolutely be lingering effects requiring frequent follow-up monitoring of kidney function, maybe liver values, heart health, for weeks or even months after they leave the hospital. Recovery from the acute toxic crisis doesn't always mean a complete return to baseline health. Chronic issues are a very real risk that owners need to be prepared for.
That's heavy. It really drives home the point that preventing this from ever happening in the first place is by far the most important strategy.
Unequivocally. Given the severity, the complexity, the potential for irreversible damage, the prolonged and costly treatment, and the guarded prognosis for many cases, prevention is absolutely the most effective, safest, and kindest approach.
So what does effective prevention look like in practice? What should people listening be doing?
Secure storage is the absolute cornerstone. Rule number 1. All human medications, that includes pills, supplements, vitamin D drops, multivitamins, and especially those topical psoriasis creams we talked about, must be stored completely out of reach of pets.
And out of reach means more than just on a high shelf, right?
Definitely. Pets are resourceful. Ideally, these things should be in locked cabinets or drawers. The sources are clear. Pets can and will chew through plastic bottles, tubes, cardboard boxes. Don't underestimate their ability to get into things if they're curious or bored. Same goes for rodenticides. They should only be placed in areas that are absolutely 100% inaccessible to pets. No exceptions.
Locked away. Got it. What else?
Safe handling and disposal is important too. If you use a topical cream like Dovinex, be mindful. Don't let your pet lick the application site on your skin. Wash your hands thoroughly after applying it. Dispose of empty tubes or old medications properly. Don't just toss them in the trash where a pet might fish them out. Many pharmacies have take-back programs for old meds.
Good point about disposal. What about diet?
Regarding diet, the safest bet for most people is to feed a high-quality commercial pet food from a reputable manufacturer that follows strict quality control guidelines, like AAFCO feeding trials or formulation standards. This minimizes the risk of formulation errors leading to excessive vitamin D. If you choose to feed a homemade diet,
Be careful.
be extremely careful. It is absolutely essential to consult with a board-certified veterinary nutritionist. They have the expertise to formulate a diet that is truly complete and balanced. It is incredibly easy to accidentally create nutrient imbalances, including dangerous vitamin D excesses, if you're just mixing ingredients at home based on recipes found online or in books without that professional oversight. Don't risk it.
So it really boils down to conscious choices and actions by us, the owners, how we store things, what products we use, and how we handle them, and ensuring their diet is properly balanced.
Exactly. Most of these poisonings are tragic accidents. They happen because a pet accidentally encounters something toxic due to maybe unsecured storage or a lack of awareness about the potential danger of a product. It's not usually the pet intentionally seeking out poison, so prevention relies heavily on us, on owner education, and making conscious changes to our habits and home environment to minimize those risks.
Okay, wow. We've really gone deep into this, unpacking what makes vitamin D, something so essential for life, turn into something so incredibly deadly when our pets get too much of it.
Yeah, we've pulled from the sources how surprisingly common items in our homes, things like rat bait, yes, but also human vitamins, skin creams, and even mistakes in pet food formulation can pose these hidden serious dangers.
And the key takeaway seems to be that vitamin D toxicosis is severe, it's complex to treat, it requires immediate, aggressive veterinary intervention,
Often leading to prolonged, expensive hospitalization.
and carries that real risk of serious, potentially permanent long-term organ damage, especially to the kidneys.
Absolutely. Which means the absolute best offense here is a really good defense. Preventing exposure in the first place, secure storage of anything potentially risky, and careful management and selection of their diet.
And maybe the most crucial point for anyone listening, if there is ever even the slightest suspicion that your pet might have gotten into something, a dropped pill, a chewed tube, accessible bait, don't wait. Don't watch for signs. Call your vet or an animal poison control hotline right away.
Immediately. That early action, that phone call, truly can make all the difference. It might be the difference between a treatable situation and a devastating outcome.
Definitely. Thinking about how common and accessible many of these sources are, the vitamins on the counter, the cream by the bedside, the bait maybe forgotten in the garage, and considering the serious, potentially silent and irreversible damage it can cause, here's something to maybe leave you with. Considering that so many of these poisonings seem to stem from just accidental encounters with everyday things, how can we, collectively, maybe raise the bar? How can we change our habits and our home environments to make them fundamentally safer spaces, protecting our pets from these unexpected toxins hiding in plain sight?